Thank you very much, and good afternoon, everybody. It's absolutely a pleasure and a delight to be virtually with you this afternoon. And thanks for the kind introduction. I'm John Rayner. I work for HIMSS, and as many of you will know, HIMSS is a global not-for-profit organisation focused very much on improving health through the effective use of information and technology. And we've used our maturity models over many years in 35 countries, and we believe that we've had an indirect effect on over 800 million people. My current responsibilities are in Europe, the Middle East and Africa. I just thought I would give a definition on the first slide. Wellness is something that one has to work at. It doesn't happen by accident or on its own accord. We have to take positive and meaningful action to remain or become well. In difficult times, the effort required to attain wellness is greater than it would otherwise be, and sadly for some, wellness is an absolute challenge and quite possibly an unachievable goal. I'm going to give some insights in the next 15 minutes or so from the perspective of a member of the public or from someone working in the health sector. Before I do that, I was a pre-COVID frequent flyer and regular traveller. I visited hospitals all over the world. I spent time in healthcare systems that were highly developed from a digital perspective and in some that were less so. It might seem obvious now in retrospect, but in the most successful countries, regions and indeed hospitals, I often came across three things. I think the first thing is the recognition that resources are required in order to make the necessary investments to innovate. And we all know, of course, that innovation helps organisations often survive in difficult times. It wasn't just the use of resources that I saw. It was the willingness to spend money on the right thing and to ensure that that spending had the desired effect. And those three things together are really quite important. The second is that I often saw high levels of clinical engagement, patient engagement, and citizen empowerment. And we often test for those things and for that level of engagement, specifically amongst clinicians and patients, by measuring the degree to which these groups engage with technology and use that technology in a meaningful way. The third observation, however, is perhaps the most interesting, and it's in those highly successful organisations, regions, and indeed countries that I saw examples of quite outstanding leadership. This was rarely one individual, but often a large group of individuals who were able to create a culture that allowed others to thrive, prosper, and to deliver amazing things. And you are often very much touched by the culture of organisations very quickly after spending a relatively short time in those organisations. And an old adage that goes back many years is around managing the culture and then letting the culture manage the business, which would suggest that the culture of an organisation is quite a powerful thing. And this really is where I start the journey today, recognising that when I speak to health professionals, about what they have needed over the last 4 to 5 months, the concept of compassionate leadership comes very, very close to the top of their hierarchy of needs. They want leaders who can actively listen in order to arrive at a shared understanding, or who are willing to offer transparent communications that are free from spin, personal opinion and myth. And this is often more about, or sorry, less about what is the matter and more about what matters to you. And you know, one can imagine that certainly health professionals have a whole raft of different needs and requirements as we've passed through this very, very challenging period of time. And health professionals have often said that we want to be able to share our own feelings freely with others in order to obtain a response that is of mutual benefit. And I would suggest that compassionate leadership is so important in these unprecedented times. There's been approximately 500 deaths of healthcare workers in England and Wales, and similar numbers in the US. This cannot go unrecognised, and leadership styles must be responsive and be able to accommodate this extremely sad and unfortunate position. However, I do hear some saying that this is just about positive leadership rather than compassionate leadership. For some hospital workers, positive leadership seems to be a more palatable expression. Maybe for some, compassion may display an area of weakness. I personally think that's a bit of a cop-out. Positive leadership can mean all things to all people, and it can be a bit of a smokescreen for pretending that these problems don't exist. And then the individual may then go on to fail to address the endemic problems of potential bullying, harassment and discrimination. So compassionate leadership requires huge courage, resilience and belief. It requires commitment by you as a leader to be the best that you can be. It's about making that right decision on a difficult day. Compassionate leadership can be magical when we get it right. In preparing for the presentation today, I'd always thought about describing a number of personas, some typical personas that we often see when trying to provide examples of how different people have dealt with situations in very different ways. But then I realised that many of these personas were actually within my own family. So it seemed a much more personal thing to talk about my own family members and how they have come through the last 4 or 5 months and how technologies have helped to support them in this difficult time. So I'm going to start with my niece, Jodie. Jodie's 30 years of age. She's a paediatric ICU nurse, and I spoke to her on the telephone the other day, and she was amazingly positive about the experience, despite the very traumatic and often challenging times that she spent personally caring for patients. She said that the NHS in England had been great. They had provided free apps, mainly around mental well-being, mindfulness, to help with relaxation, yoga and exercise. but she'd also received online psychological support from the psychological medicine team in the hospital which she worked, and she had access to online counselling by the NHS Healthy Mind Service and some online CBT. And despite some quite difficult times, she remained positive. She said the last 4 months have been really tough. I trained as a paediatric ICU nurse and have suddenly had to learn how to care for adults, which has been a real challenge. We've had access to some amazing free apps as part of the NHS access to the online counselling through the Employee Assistance Programme. It's been really helpful. That the wellness apps were particularly helpful. So quite a positive story there. Nothing particularly sophisticated as described by the previous speaker, but clearly very, very effective. My next special person is my mother. She's 89 years of age. She's retired. She doesn't take any medicine. She's fully mobile. She's mentally active, slightly deaf, and she really appreciates face-to-face conversation rather than conversations on the telephone. She often struggles to hear. She's been in self-isolation for the best part of 4 months and has coped really well with it. She's managed to get out and walk 3 or 4 kilometres every day. Didn't previously use technology, but none of the family members would really appreciate or anticipate not being able to have a face-to-face conversation with her. So we obtained an iPad, connections to the Wi-Fi, and that really has transformed the isolation period, the quarantine period for her. She said that the iPad has really been useful to keep in touch with my family during the lockdown. I can imagine to use a mobile phone and FaceTime but on the iPad, but not much else. If older people could learn to use an iPad to speak with family, it would improve their mental health. The main thing is being able to see someone's face. When you are a bit hard of hearing, it's useful to see someone's face, that you can see their lips moving. This is Megan. Megan is a family friend. She's 23 years of age. She's profoundly deaf. She's been deaf from birth. She had a renal transplant when she was 2 years of age, and she had a cochlear implant to help with hearing when she was 3. She works as a nursery nurse assistant, and she, as one could imagine, throughout the shielding process, because she was advised by the British government to stay indoors, to not go out, to keep away from people. She's used Facebook presentations with subtitles, a free flow app to share photographs with family and friends, and work for well-being to help with mindfulness, and she's done some yoga. She's used Zoom and Skype to stay in touch with friends, and she's had a wearable device to monitor exercise, steps and diet. Clearly diet and fluid intake is very important to someone who's had a transplant. I couldn't have much of a conversation with Megan for obvious reasons, but her mum said this has been a really difficult time for people who are deaf. Wearing a face mask makes it hard for Megan to understand people who cannot sign. Her mental health has been affected by a lockdown, and at first she had no idea why she could not go out. The hospital has only contacted us by phone, which has meant that all the conversations have been with me rather than with Megan, which isn't appropriate when my daughter is 23. Megan said, I felt very lonely. I've spoken with a counsellor new users sign on Zoom, and that has helped. So my daughter, age 26, she's an actress and a teacher. Lauren has suffered with one or two mental health problems in the past, from an eating disorder as a teenager to anxiety later in life. Lauren thrives on routine and meeting goals that she has set herself. She wasn't looking forward at all to spending 4 months in a very disorganised and unstructured way. She's used a number of meditation apps to relax. She has participated in exercise classes on YouTube. She's taught fitness and taught dance also on Zoom, and used IGTV. Motivation classes on Instagram were very much a part of her daily routine. Lauren says the last few months have been really interesting. As someone who needs a routine, I got up early for online exercise classes and established a timetable around my online teaching commitments. Technology contributed in a positive way to my mental, physical and spiritual well-being. It would have been very different for someone like me, whose mental health at times has been a bit fragile. I have continued with the healthier lifestyle that I established during the height of the pandemic. A couple more. My wife, age 57, is a Chief Information Officer. She has used exercise apps, MS Teams, to stay in touch with people from work and to work from home, Fitbit for daily exercise to monitor steps and miles, Zoom for video conferencing, and set up an attend anywhere for local GPs to continue to see patients remotely. Mandy says that the technology I was able to use at home reduced a lot of my stress that I would have associated with a 4-month lockdown. We were able to continue and in some cases accelerate projects because of the availability and performance of the technology. It's been very stressful it would have been very stressful to have had long communication gaps with my work colleagues. And finally, my nephew Tom, who's age 21, a final year student at Durham University in the north of England. Tom has used Zoom for weekly quizzes, a virtual running club using Strava. He took his final exams online over a 48-hour period, used a fitness tracker for competitions with university colleagues, and has participated in a number of online work experiences in banking, commercial law and management consultancy. Tom says, "This isn't how I wanted to spend my final year at university. No opportunity to celebrate, no end of year events and no graduation ceremony. The university have tried to maintain contact through social media and video conferencing platforms, which have been quite good." So just one or two final thoughts, maybe to pull some of these quite random stories together. The stories from my 6 important people have all mentioned technology, and the conversation with them didn't prompt that at all. The technologies are all relatively simple, intuitive to use, easy to acquire, and relatively inexpensive. Many of the technologies have been an aid to communication in the form of widely available video conferencing platforms. The stories from the 6 people have all mentioned mental well-being and have made the link between the technology and improving their own mental health. I didn't expect that. I expected for many people the technologies to be exercise dominated and communication. I think there's a clear link here between communication with people, having real-time conversations and maintaining one's mental well-being. Interestingly, when I look back at the HIMSS Analytics annual survey in 2017, I found that CIOs in all the European countries surveyed wanted to improve their leadership skills. In 2020, once again, our trend barometer found that technical foundations for telehealth were already in place in all European countries before the pandemic. They were not widely used, but they were in place. Video conferencing is now being used for well-being as well as delivering direct patient care. And for some, technology used in the last 5 months has been quite life-changing. Who would have ever thought that a video conferencing platform would assist with wellness? The truth is, out of all the technologies available, from the tools that help people become less sick, biometric sensors, healthcare workers, work-life balance apps, and even robots with infection for use within infectious environments, to data apps that help identify patterns of risk, risk spreading, and risk stratification. The simple need to communicate with those closest to us has been an overwhelming feature of the past 5 months. And I will leave you with that thought. Thank you very, very much for your attention.